Hi everyone, my name is Heidi Geurtz and I'm going to be doing a presentation today on a new FDA drug that was approved in 2022 called ENJAYMO. So to start off this presentation on ENJAYMO, we're going to talk a little bit about what the drug is used for. So ENJAYMO is used to treat the symptoms and disease of cold agglutinin disease, which we're going to be going over here shortly. So let's talk a little bit about what cold agglutinin disease, and then we'll get into the pharmacokinetics of ENJAYMO related to the disease. So cold agglutinin disease is a form of anemia that is autoimmune. The result is that a type of IgM antibody called a cold agglutinin binds to a red blood cell, making them hemolyze via the body's immune system. Once the IgM antibodies are attached to the red blood cells tend to kind of clump together and create some emboli before hemolyzing. There are two different types of this disease. There is a primary and secondary version of it. The primary version is most of the time an unknown etiology, but it doesn't occur in the presence of other diseases, versus the secondary version of it happens when there's already an underlying disorder, and then you get cold agglutinin disease from the underlying disorder or as a result of. The most common symptoms associated with this disease are signs of anemia, so like weakness, fatigue, muscle soreness. Raynaud's phenomenon is one of the hallmark signs, so that's going to be like cold fingertips, toes, nose, lips. That'll turn blue, and then a lot of times they'll turn white, and then you'll see gangrenous kind of ulcers start to develop towards the end because of the lack of blood flow. This happens typically in an environment that is 50 degrees Fahrenheit or less. A more severe consequence of this disease is the development of venous thromboembolisms. The IgM antibodies make red blood cells adhere and cause embolisms. Syncopal episodes, dizziness, and cardiac arrhythmias are some other major complications. To diagnose this disease, a complete blood count or CBC is done, a blood smear is completed, a reticulocyte cell count, a bilirubin count as well, haptoglobin, and a Coombs test is completed to identify the specific type of hemolytic anemia. So now that we've talked a little bit about cold agglutinin disease, what it is, how it works, and the pathophysiology of it, we're going to discuss how ENJAYMO works on the disease and its mechanism of action, specifically related to cold agglutinin disease. So ENJAYMO is a man-made monoclonal antibody that inhibits the C1 immune pathway. So in cold agglutinin disease, the IgM antibody triggers the C1 activated hemolysis by binding to the C1 activation site on the red blood cell. So the way ENJAYMO works is that it binds to this open activation site on the C1 receptor site, binds to it, fills it, and therefore the IgM antibody of the cold agglutinin can no longer bind to that site, and it prevents the whole cascade of the C1 autoimmune system causing hemolysis to even begin. So it prevents any of that cascade. So the way ENJAYMO works, like we just talked about, is that it inhibits the C1 immune pathway. And because of this inhibition, not only do you get rid of the cold agglutinin disease, but you also get rid of a part of your immune system. So the patient becomes immunocompromised and susceptible to opportunistic organisms. This is one of the main side effects of this medication, is that the patient is now susceptible to really severe organisms like meningitis, pneumonia, and influenza. ENJAYMO also increases the risk that the patient will develop another type of autoimmune disease, most specifically lupus erythematosus. And some of the other most common side effects that are less severe are hypertension, UTIs, edema, joint pain, nausea, headache, cough, and a runny nose. Now, since we've just discussed the side effects, we're going to talk about the adverse reactions that have been discovered related to this drug. This medication has a high rate of serious side effects, with the most common of them being the Raynaud's phenomenon. Although this is a characteristic of the disease itself, on the medication's website it's listed as an adverse reaction to the medication. Enjaymo is used intravenously. So 29% of those patients experience infusion-related reactions, and infusion-related reactions include chest pain, hypotension, rash, flushing, tachycardia, and shortness of breath. So some pretty severe adverse reactions to those IV infusions. The only contraindication for this medication is a hypersensitivity to the active ingredient in the drug. Another notable thing to discuss that is not necessarily a contraindication or a black box warning, according to the FDA, is breastfeeding and pregnant women. So there is little to no research, and it is not definitively known if Enjaymo crosses the barrier between mother and fetus, and then if it also goes into the breast milk to get to infants. So that would definitely be something to discuss with the patient if they're going to be taking this, and their OB as well. Finally, now that we've discussed pretty much everything about the medication, we're going to go into one of the most important parts, is what you would discuss as a provider with your patient who is going to be on this medication, what to watch out for, things to prep for, why they're taking it, and whatnot. So vaccines in this patient population, it's really important that before the patient starts the infusion treatments, that all of the vaccinations are completely finished 2 weeks prior to the infusion. The website and manufacturer of this medication states that you can be vaccinated after starting the Enjaymo treatment if it's an emergent type of start, but it is recommended that you do vaccines 2 weeks prior to starting the infusions. What to expect during the infusion. So infusions can be given at 3 different areas. It can be at the patient's house, in the clinic, or in an IV infusion center. The infusions should last about 1 to 2 hours depending on the dosage, and the patient should be monitored closely for any adverse reactions. After the infusion, the patient will be monitored for the first 2 hours after the first dose, and then every dose subsequent to the first dose, they'll be monitored 1 hour after for adverse reactions. So this drug is a weight-based drug. So the drug is administered in a loading dose, starting the first 2 weeks, where you get 1 transfusion every week for 2 weeks, and then you move over to an every 2 week schedule of infusions of this medication. So let's talk a little bit about stopping the therapy or trying to wean off of it. So Enjaymo therapy is to be continued for the rest of the patient's life every 2 weeks. After about 9 weeks, the medication is completely out of the patient's system, and the receptor sites are again open on that C1 immune pathway, and the coagulin can bind again, and then you just get a reoccurrence of the disease, including hemolysis and anemia. So the medication cannot be stopped, and dosages should not be missed or delayed. When taking Enjaymo, there's a couple times that a patient should be told to call 911 as a secondary adverse or side effect from the medication. Some of those that would be good to talk about with the patient would be dizziness, syncopal episodes, any type of like cardiac arrhythmias, palpitations, chest pain. All of those kinds of signs and symptoms should be an immediate 911 call and could be a potential side effect from this medication that patients should know about. And that is going to be the final conclusion of my presentation. The next slide is my references, but thank you so much for listening.